People with alcohol use disorder don't need to suffer or feel shame or rely on abstinence to regain control. That's because alcohol use disorder is a treatable medical condition and a full recovery is possible. Overwhelming evidence shows that certain medications can alleviate cravings and withdrawal symptoms, making how much your patient drinks a personal choice, not a compulsion. Help transform lives. Learn to prescribe for alcohol use disorder. Routinely ask your patients about alcohol consumption using a conversational approach. Use tools such as SASK or Audit C. If your patient screens for high-risk drinking, undergo a diagnostic screening using DSM-5 criteria and take a detailed history and assessment. To begin, discuss your patient's drinking goals, whether that's to reduce drinking, reduce heavy drinking days, or stop drinking altogether. Then, assess the patient. Take a detailed history, do an exam, and order investigations. Want to know more about taking a history specifically for AUD? Now you're ready to consider medication options. This choice depends on your patient's consumption habits, history, and on their drinking goals. Your patient's goal may be to cut back or decrease heavy drinking days. Consider naltrexone. Your patient doesn't need to stop drinking to start. A typical dose is 50 milligrams once a day. Don't prescribe if there's liver failure or acute hepatic injury. In case of nausea, consider a lower dosage. Start lower dose and titrate to avoid gastrointestinal side effects. Your patient's goal may be to stop drinking altogether. Consider a camprosate. Your patient needs to be sober for 3 days before starting. A starting dose can be 333 milligrams 3 times a day. A typical dose is 666 milligrams 3 times a day. A camprosate can help with anxiety. Don't prescribe if there's renal impairment, and think about withdrawal management. Your patient's goals may be to reduce or stop drinking. Consider topiramate. Your patient can start while still drinking. A typical dose is 25 to 100 milligrams per day. Start with 25 milligrams once a day and titrate weekly. Split the dosing if it's more than 50 milligrams per day. Don't prescribe if pregnant or known glaucoma. Consider using if your patient or their family has a history of stimulant use, PTSD, or bipolar mood disorder. Watch for dizziness, drowsiness, fatigue, and impaired vision. Discontinue slowly to avoid withdrawal syndrome. Your patient's goal is to reduce drinking or maintain abstinence. Consider gabapentin. Your patient can start while still drinking. A typical target dose is 600 milligrams 3 times a day. Start with 100 to 300 milligrams per day and titrate every 5 days. Gabapentin can help with mood dysregulation and sleep and is a good add-on to other medications like naltrexone. Watch for dizziness, fatigue, and medication abuse potential. Want to know more or find out about other emerging medications? Choose the best possible medication that matches your patient's goals. If one doesn't work, try the next. Combining these medications can be helpful. Exclude absolute contraindications before starting, but remember, in most situations, the benefits of prescribing often outweigh the risks. Choose a medication with a dosing requirement that is practical for your patient. Manage the patient and family expectations. Discuss the goal, explain how the medication works, and make sure they understand how to safely reduce drinking. Talk about the benefits of a healthy lifestyle. This includes exercise and social connections. Include information about healthy eating, particularly omega-3 fatty acids, which help the brain heal. Offer to connect your patient with mental health and/or substance use resources. Always offer, never force. Consider complementary supports such as counseling, specific programs, and services. It's important to arrange follow-up in a week to review medication response and screen for possible side effects. To learn more, visit the Canadian Alcohol Use Disorder website. Find prescribing guidelines, medication selection tools, and much more. There is hope for people suffering with alcohol use disorder. Help your patient take the first step.